So at this point we're ready for illustrating or demonstrating the casting of a foot, and we're using an SDS sock for this procedure. You can use plaster of Paris if you want, or a polyester wrap, as long as we do the similar thing that we're going to show you here. If you do an SDS sock, then when we scan this shape, we know we have 2 millimeters difference between the foot and the cast. So if we scan on the outside, we just have to subtract 2 millimeters and we should be at the exact measurement of the foot. With a plaster of Paris wrap, we don't know how thick that wrap is going to be. Same thing with polyester. Then you have to pour it and then scan it, which means extra work, but it can be done. But as long as we follow the same casting procedure. So for these casts, we need, the most important thing is to start with is the casting platform that has to have a heel height built into it and a soft layer on top to make sure we capture a nice plantar surface of the foot. We need some gloves, very important. We need a plastic bag to cover the foot. We need a strip to have a cutting strip on the instep on the leg, and then a casting sock, scissors, felt marker, and a ruler. Okay, so those are the basic things we need. So before we do anything, we always want to practice the positioning with the patient, so we make sure we have everything in the right angle. If we cast like this, we know we're going to have the heel height. We know we have a nice plantar surface of the foot, and we don't want to cast like this, okay? Then the foot is plantar flexed, the leg is going backwards. That is not a desirable position, because if you have to put an ankle reinforcement between the lining, that's not going to fit at all. You got to make sure that you cast the foot the way you want it to be in the shoe or boot. So in this case, this would be probably the ideal situation. So before we start, we just put this strip. I ask Eric to hold this, and I'm just using a little bit of simple tape to make sure it doesn't move around on the foot. So we'll just place that on here just to make sure it stays where it needs to be, just so don't get any wounds. And one here, and he's got nice hairy legs, so we'll take that off. Okay, now you can let go. Then we'll cover this with the bag. And we're going to take this cast a little higher. Again, we're going to practice this. One thing, make sure that you tell the patient that they are not supposed to look at the cast, because what happens when they want to see what's going on, they put their knee like this, they turn it outwards, and then all of a sudden the angles are wrong. So just don't be shy and say, please don't look, because we want to make sure the angles are correct. So make sure you control your patient that way. So at this point, we're putting the gloves on. And the casting sock gets taken out of the bag. It's important and helpful to have some warm water instead of real cold water. The material, the sock softens up when you use warm water, and it's easier to get around the foot. Now this is a little bit of a higher sock, so sometimes it's a little tricky to get this all in. So make sure the heel is away from you. Then I take the inside of the sock and I bring my fingers all the way to the inside of the sock towards the toes. So now I have the ring more or less, and my fingers are at the end of the toe. Put it in the warm water and squeeze it a couple of times. get the water out of it, pull it out, okay? Ask the patient to lift their foot up and apply the sock. This is quite the high one, but that's okay. And then rest it back in the same position as you had it before, and make sure that the patient does not start trying to look and see what's going on. So at this point, keep massaging the whole leg and dorsal part of the foot. Don't just walk away and say I'll come back and cut it off in a few minutes, because that is not really desirable. So, okay, so that is just about ready. So at this point you can take your gloves off, dispose of them, and at this point we're going to put a little 90-degree mark on the cast. And in an ideal world, we'll do that on the back too, but we'll leave that one for now. All right, at this point, we can't take it off yet, but what we can do is create the cut on the instep, because the cast is still not totally set up, and you can actually safely cut it, but it's not ready yet to come off. So at this point, you just kind of let it set up more, and you just be patient. Do not take it off yet. Take your time, okay? The other thing we have to do is make sure the plastic bag is cut all the way, so that it does not go into obstruct with taking the cast off. You can tell it's still a little soft, but we're just going to give it some more time. Probably have to edit that out of there.
Do you want me to pause it?
No, let it rip.
That is the setting part.
Yeah. Okay, at this point the cast is probably ready to come off, so you ask the patient to lift the foot up straight up in the air. Make sure the bug is lifted forward, and just peel this off the foot. Don't worry about the bag. And now we have captured the foot. Now, it is very important to actually make sure that this closes nicely. I get cast into the facility that come in like this, and then it's all set up. So you want to use a piece of tape or something elastic to make sure, because this cast is still setting, that it is closed nicely and we don't have any gaps on the instep where we made the cut. So now we have the cast, we have some heel height, we have a nice plantar surface on the foot, and we are ready to scan this on the outside because we know the thickness of the sock, and we don't have to pour this with plaster of Paris. It'll be fine the way it is. That's the advantage of an STS sock. If it was plaster of Paris, we have to close it up, pour it with plaster of Paris, and then process it. Now, by processing, I mean scanning. As we all are aware, scanning technology is becoming more and more a used feature. We scan every cast, and every last that we make is made from a scan. What type of scan? It can be an iPad scan. It can be a Yeti scan that we have in the back, which is our conventional scanner, laser scanner. And some people might ask, why don't you scan the foot directly with a structure scanner? Well, we're going to go over that in a few minutes.